Okay, we'll start. It's 1:30. Today we're going to talk about placebo and placebo effect, and the definition of placebo derived from the Latin is I will please. At the end of the talk, I'll talk just for a moment about nocebo, which means I will harm. There are substances which are placebos, and there are methods and procedures which are nocebos. A definition first, though. Placebo is any dummy medical treatment. Dummy being defined as having the appearance of being real. Primarily, these are pills, and they have the appearance of being like all other pills, different shapes, colors, and so forth, but they are actually inert. About 60 years ago, a definition of a placebo would be a medicinal preparation having no specific pharmacological activity against the patient's illness or complaint and given solely for any psychophysiologic effects of treatment. Now, this day, in the 21st century, a placebo would be a dummy treatment administered to a controlled group of patients in a controlled clinical trial in order that the specific and non-specific effects of the experimental treatment can be distinguished. The experimental treatment must produce a better results than the placebo in order to be considered effective. And in a moment, I'll get into the trials which determine the effectiveness of any drug. The placebo effect is defined as the sum total of all specific and non-specific effects, both good and bad, of medical treatment, primarily psychological and psychophysiological effects associated with the physician-patient relationship, which is very important, and the patient's expectations and apprehensions concerning the proposed treatment. Now let's talk a moment about cause and effect. If one event comes immediately after another, people naturally assume that the first is the cause of the second. If you flip a switch and the light goes on, you expect that when you flip a switch, the light will go on. If you push a button, the elevator door opens. If you turn a key, your automobile starts. Cause and effect. Sometimes, however, people see connections where none exists. For example, lucky socks for athletes, a lucky pen for students, all kinds of amulets, medals, rings, copper bracelets, tattoos, lucky charms. These all allow our superstitions, our hope, and our faith to make us believe that these things will protect us from the vicissitudes of life. This is why some ineffective treatments were thought to work. For example, a patient has a high fever, and in the days of George Washington, the doctor drained a pint of blood, or the Indian shaman chanted a ceremonial ritual. People naturally assume that these actions must be the reason that the fever broke. To the person desperately seeking relief, getting better was all the proof that was necessary that the treatment was effective. Unfortunately, these cause and effect relationships observed in the early days of medicine were rarely correct, but they did enough to perpetuate centuries of ineffective treatments. Many acute diseases, particularly infections, given enough time, will get better all by themselves. The body heals itself, and the disease runs its course. Many chronic diseases wax and wane spontaneously. Colds are gone in a week. A migraine headache is gone in a day or two. Broken bones heal. Heart attacks and pneumonia don't always kill, but frequently they do, particularly if you have a left main coronary artery closed up, and that's the famed widowmaker. Before the day of antibiotics, pneumonia was the old man's friend. and put him out of his misery. Sometimes we wish we didn't have the antibiotics when the end is about to appear. Thus, many treatments may seem to be effective if given enough time, and any treatment given near the time of spontaneous recovery may seem to be dramatically effective. The placebo effect may be a response to the belief in the power of the treatment and occurs often enough to make a person feel better. Although belief cannot cause an underlying systemic disease to disappear, people who do believe they're receiving a strong and effective treatment often feel better, and their symptoms of pain, nausea, weakness, and fatigue, and many others can diminish with powerful reassurance by a respected practitioner and accompanied by the giving of medication. This effect may happen even if the drugs contain no active ingredient and can be of no possible benefit. When a placebo is given, why does this happen? When a person goes to see a health or healing professional, regardless if it's a physician or a chiropractor or a psychologist or a nurse practitioner, and especially when you're consulting a surgical subspecialist, that patient, that person, has expectations of consulting a mentor, a person of wisdom and authority, who has the power to treat, to heal, to cure, and return the person to a state of good health. That expectation responds to the white coat of the physician, the stethoscope around his neck, the professional office environment, the credentials on the wall, a myriad of laboratory tests and equipment available, and encased in this environment, the patient is filled with faith and hope. The final incentive to get better occurs when and if he gets the bill. Surely this treatment is worth the cost, and surely I will improve. As an aside, when I was in the Navy in the early 1950s, at Guantanamo Bay in Cuba, they were inundated by dependent people seeking medical attention. And so they charged 50 cents per visit. And that cut the visits down by 50%. If you pay, and I really believe this, you, as a patient, you have to give something of yourself in order to kick in the mind and body function that helps to make you better. If everything is free and somebody else is footing the bill, I don't think you have the incentive to get better as fast as you might otherwise. All right. When a physician makes a diagnosis of any serious or potentially disorder or disease, he must prescribe medication or procedure that has been proven to have a scientifically beneficial effect on that particular ailment or disease. And he must have a discussion of the important side effects of treatment given to the patient. When we're talking about placebos, we're talking about people with problems who have subjective symptoms without the benefit of physical findings, laboratory findings, or imaging findings of disease. The worried well. A large percentage of people who go to the doctor are the worried well. In medical research, however, clinical trial studies require that a placebo be given to a masked group of patients to act as a control in testing the efficacy of any treatment drug. The pharmacist constructs an exact duplicate of the treatment drug, and each patient and drug is numbered so that the dispensing physician and the physicians monitoring the patients, who are not the same physician, they do not know which person received the active drug and which received the placebo. The numbered code is broken only after the study is completed, 6 months, a year, 2 years later. This is called double blinding. In the course of time, all patients are followed, and the results of improvement or stability or regression are documented. Side effects or adverse reactions are also recorded. In this manner, a prospective, randomized, placebo-controlled, and double-blinded study has been completed. The researchers doing the study should have total control of the study, and they should not be interfered with by the pharmaceutical sponsor who's putting up the money or the grantors of a federal subsidy. This is the only scientific way in which you can tell a drug or anything medically is effective. Now, let's talk for a moment about sham surgical operations. These are operations performed by surgeons, but the people who evaluate the effects of the surgery 6 months or a year down the road are not the same people who did the surgery. Now, I'm going to give you 2 examples of that, both of which I've talked about before. Back in the late 50s and early 60s, before the onset of the heart-lung machine, which allowed open heart surgery, they did an operation called the internal mammary artery ligation for patients with angina, with coronary insufficiency, chest pains, recurrent. The internal mammary arteries run on the inside of your rib cage down the front. Internal mammary arteries. They made 2 incisions, one on each side. They look like eyebrows, and so this was called the eyebrow operation. They made this small incision, they went in, they separated the internal mammary out and ligated it, and then closed up the patient. And in a significant number of patients, the result was good. And the statisticians said that this was a reasonable procedure and it worked. Except that a few years later, the surgeons just made the incision and did not go into the internal mammary artery, left it alone, closed them up. These patients were evaluated, and a significant number of the patients got better. Now, I didn't say their disease was cured. I said their symptoms were better, because symptoms are subjective feeling. Now, when we talk about osteoporosis and back pain, we talked about the compression fractures that occur in postmenopausal women. And one of the treatments, or several of the treatments of this problem, is called a vertebroplasty, in which the surgeon goes in and puts in a cement into the collapsed vertebrae to expand it and bring it back to its normal size. They can also use mechanical means to do this. Well, they do it at a cost of several $1 billion a year. It's a very popular operation for people with chronic back pain, particularly postmenopausal women with significant osteoporosis. The problem is they then did a study in Australia, which I talked to you about before, in which they just made the incisions and didn't do anything. And after 6 months, in comparing both groups of patients, surgical patients and sham patients, the results were the same. Meaning that the operation was probably not as effective as originally thought. Again, that would be a form of placebo. All right, critical evaluation of a treatment protocol requires more than one patient getting better. Good results in a group of patients is less likely being due to chance. The larger the group, the more likely any observed effect on the disease is real. But even after FDA approval, there may be unexpected consequences that require pharmaceutical companies to withdraw that drug from general use. A classic example of this was the rise in cardiovascular disease, heart attack, and stroke in postmenopausal women who used estrogens for menopausal symptoms. This caused, from around the late 1990s into 2000, caused many, many doctors to stop treating menopausal complaints with estrogens. So what is the result of that? Well, maybe, and I'm saying maybe because I don't think we really know, Maybe there's less heart attack and stroke, but there's one hell of a lot more osteoporosis. Because estrogens are wonderful for putting calcium in the postmenopausal women's bones. Now, placebos, as well as potent medications, have side effects. In a controlled study, effects for the potent drug and for placebos are listed in the results, even though placebos are inert. Many patients report symptoms of headache, dizziness, nausea, diarrhea, fatigue, pain, and others. Note that all of these symptoms are subjective. You can't measure pain. All right, so what do I have here? I have a couple of examples to show you. This is the first example is Lipitor. Lipitor is the most popular statin that is used for lowering cholesterol, and it is a very effective drug with very few side effects. But in the studies, and this was taken out of Physician's Desk Reference, which is the big thick book I brought up and showed you one time. And this is the results that are given to the FDA to get their approval. But for our example, we're here to show the placebos have symptoms, even though they're inert. In arthralgia, 4.3% of the Lipitor patients had arthralgia, and 6.5% of placebo patients did. Myalgia. Now, myalgia is the principal side effect of the statins. It occurs in less than 1% of people, but there are all kinds of people say, oh, it causes me muscle pain, and they don't take it or don't change the drug. But 2.7 versus 3.1. Nausea, 3.8 versus 3.5. Insomnia, 2.8 versus 2.9. So what does this mean? To me, this means Lipitor is a great drug and doesn't have any side effects, or very few. And let's go to Aricept. This is the most popular and commonly used drug in Alzheimer's disease, particularly in early Alzheimer's. It is effective in early Alzheimer's disease. However, the disease progresses regardless. We have no medicine which prevents, it may slow down the progress, but we have no medicine that stops the progression of Alzheimer's. Arthralgia again, 2 versus 1. Myalgia, 6 versus 2. Nausea, 11 versus 6. Insomnia, 9 versus 6. There are more side effects with Aricept, but it's the only drug we have. Well, we have another one called Nimantine that works in this problem, which is an oral support. And then finally, one for diabetes. Metformin is the most popular diabetic medication. Diarrhea, 5.1 versus 12.4. What kind of group of people in that? Nausea, 11 versus 6. Headache, 1.9 versus 4.6. But again, given medication where you don't know whether it's real or fake, all you do is report your symptoms. And so this is why these controlled blinded studies must be done, so that you can really find out if the drug is effective and what the side effects are. Now, the most frequently prescribed placebos were antibiotics for viral infections. People bring their kids in for ear infections and upper respiratory infections, and the mothers really kind of demand treatment. And the problem here is giving antibiotics for people who demand treatment. All that does is create resistant bugs that you can't treat with anything because they mutate to the place where none of the antibiotics work. We're seeing that now in tuberculosis, and it started in the papers the last few weeks about tuberculosis in India being resistant to all the drugs that they have. All right. Another one that's used a lot is anti-anxiety drugs for people who are anxious or who have neurotic complaints. A lot of side effects to these drugs and a lot of problems with addiction. And so oftentimes the physician may give something which is not really effective for the problem, but in a way helps the patient to, with the proper approach by the doctor, to take the medication on a long-term basis. And I'll come to that later in the talk when I talk about the recent article in the AMA that I brought with me. Most people who go to the doctor for a problem, they kind of expect and want that he gives something tangible. Unfortunately, advice and counsel and a sympathetic ear doesn't do a lot for a lot of anxious people. And so this of course, this suggests mental issues and instability in the patient, but at the same time, it's difficult to handle, and oftentimes substances are used as placebos. And I'll show you in a minute, or in a few minutes, how these...
What is used as placebo?
Inert substances.
Oh, inert.
You use sugar pills, and the pharmacist has a slew of these things. Now, I want to spend a moment about homeopathic medicine. All of you are old enough to remember homeopaths. Matter of fact, I was born in a homeopathic hospital. This was very popular from the early 1900s to about 1930. Homeopathy is a science of medicine where minute substances are given, either singly or in combination, supposedly to have an effect on the particular symptom or disease that you're trying to treat, except that the substances are in such tiny amounts that they're totally ineffective. So homeopathic medicine is now considered a placebo treatment. Now, holistic, natural, and alternative therapies are placebos for the most part. Promoters, entrepreneurs, and hucksters are like the old medicine man hawking his wares from the back of a wagon with an elixir which cured everything and was probably 50 or 60% alcohol. Lydia Pinkham's Hadacol, you remember. Now, today, however, we have modern day promoters who are very expert at advertising and marketing. And if you read, I enjoy reading the full page ads for treatment of my sore knee or my dizziness or whatever they're going to treat me with. And they have testimonials, anecdotal experiences from one or two people or more. And they use this to convince the customers that their products will do miracles for whatever ails you. Doesn't make much difference what it is. These statements in the paper and on the TV are not controlled by any government agency, and they can say anything they want to say under the Freedom of Information Act or the constitutional idea of freedom of the press. If you try, I'm going to take a moment. I'm going to read you 15 natural and herbal remedies for memory loss. 15. Echinacea, saw palmetto, horse chestnut extract, ginkgo biloba, black cohosh, St. John's wort, milk thistle, horny goatweed, Chinese licorice root, lavender, pomegranate juice, garlic in all its forms, omega fatty acids, kelp, and sunflower, sesame, flax, and pumpkin seeds. All of these are effective for memory loss, according to their promoters. But is this so? Well, if it works for you, that's fine, as long as it doesn't give you side effects. It's okay. but don't try to persuade anybody else to try it. There's never a controlled trial on this, and no FDA regulation. On the bottom of the page, in print that you need Grandpa's magnifying glass to read, or on the bottom of the bottle that you buy in the health food store, it says this: these statements have not been evaluated by the FDA. This product is not intended to diagnose, to treat, to cure, or to prevent any disease. But you got a whole page up there that says it cures this. It cures a lot of stuff. But that just isn't so. Now I want to talk now just for a moment about the nocebo. Some patients believe that a treatment given worsens their problem. The patient has a negative attitude towards the substance prescribed. The pill may be inert, but the patient's mentality is negative towards his ability to get well. And obviously this means that all physical examination, laboratory studies, and imaging procedures are negative and no underlying disease is discovered. But there are people like that. There's a gentleman in England that wrote in the English publication The Guardian, April 15, 2004, 2 placebo pills work better than 1. An injection is more effective than an oral medication. Shot always works better than a pill. It's the ceremony, the cultural meaning of the therapy. That's what we're driving at here. You go to the doctor with expectations and conditioning. And if the doctor says, take this pill twice a day, morning and night, after meals, and you will get better, and you do that, in time, as most diseases get better with time, it may well work for you. Red pills are better than blue pills. Brand name advertising and packaging have as much impact as the substance itself. And that's really true. You look at the advertising on the television, you look at these full-page ads, and in my mind it costs $50,000 for a full-page advertisement in the paper. And they're going to sell a heck of a lot of pills to get their money back. But they fill up the page with anecdotal testimony, and it still says down on the bottom, it doesn't do these things that it's supposed to. And lastly, costly medicines work better than cheap medicine. And that's true as well. Now, I got time. After I finished preparing this talk, I got an issue of the Journal of American Medical Association, December 21st, 2011. And it was an article on placebo effect. And so I'm going to read you some paragraphs from that article. There are two sides to the question. On one hand, the placebo is disparaged as being inert and deceptive maneuver to please or placate the patient without any potential to produce meaningful therapeutic benefit. On the other hand, placebo effects are touted as having the power to produce substantial symptomatic relief across a wide range of therapeutic conditions. I'm going to examine two articles, one from the British Medical Journal and one from the United States Family Medicine. A substantial portion of symptomatic relief from both placebo and active ingredient drugs is derived from the positive effects of the clinical encounter with the doctor, which augments the inherent pharmacological properties of the prescribed substance. For example, in Family Medicine, published in 2010, patients with irritable bowel syndrome. Now, what's irritable bowel? Irritable bowel syndrome is gas, bloating, cramps, constipation, diarrhea, discomfort in the abdomen. Thorough study reveals nothing. Can't find a thing. So they treated these people with acupuncture, which was administered by a therapist who did not speak to the patient. He or she did the acupuncture, and goodbye. And another group, the therapist had a warm personal relationship, talked to the patient, and then gave the acupuncture. And they found that this latter group had a substantial improvement in the therapeutic result. 2 psychological mechanisms are required for success this way: expectations and conditioning of the patient. Positive beliefs about future outcome, when connected by an intervention by a respected, enthusiastic, even paroxysmal professional, can trigger a positive outcome. The simple act of writing a prescription and emphasizing the importance of a regimen can elicit a positive response. A good bedside manner requires inviting and listening to the patient's history, a careful physical examination, offering a satisfied explanation of the patient's symptoms, expressing care and concern, and communicating positive expectations for the therapeutic benefit. And finally, helping the patient to feel more in control of life in the face of illness. There's a great deal of psychosomatic illness in the community, has been for years and years. Doesn't change much. Patients' beliefs vary widely depending upon ethnicity, their unique culture, their education, their religious beliefs, their socioeconomic status, but at least some patients are eager to become active collaborators in mind-body healing practices. They wish to avoid unnecessary and harmful drugs, and they use their powers of the mind with the therapeutic aids that are well supported by scientific evidence. So there is a place to try to understand why some of these things might work. Now finally, in the Wall Street Journal of Tuesday, January the 3rd, is this one here: why placebos work wonders. That was a recent one. I had this thing prepared, but I'll throw this in too. A particular mindset or belief about one's body can lead to improvements in relieving symptoms. The mind and body are fundamentally connected, and I think that's understandable by most everybody. Studies of dieting and weight loss problems, migraine, headache, depression, certain kinds of arthritis and fibrositis often reveal striking results from inert treatment pills or sham acupuncture. Here's a good one. Fertility rates have improved in women receiving an inert placebo by as much as 40%. That's pretty good. Now, here are 2 studies from Harvard. Harvard studied 80 patients with irritable bowel syndrome. They were either given a placebo or no treatment. They were told they didn't have to believe in the placebo effect, but should take the pills anyway. After 3 weeks, the placebo patients reported feelings of relief, significant reduction of symptoms, and some improvement in their quality of life. Why? The patients had a high degree of expectation, and they were conditioned to a positive approach, and the daily ritual of taking a pill created an opportunity to change. Again, that irritable bowel syndrome is a symptom complex in which you rarely ever find any anatomical disease problem. Finally, they took this Harvard team took 46 asthma patients, and they put them through 4 kinds of treatment. Number 1, no treatment. Number 2, an albuterol inhaler. Albuterol is a bronchodilator. You use the inhaler, and it opens up the bronchial tube. Asthma is a contraction of the musculature of the lung parenchyma so that you get the air in, but you can't get it out. Albuterol inhaler. The third group was a placebo inhaler, just the inhaler with water in it. And the other one was number 4 was a sham acupuncture.
A what?
A sham acupuncture.
Oh.
If you do acupuncture and you do it properly, You have to put the needles in the place where the ancient Chinese said to put the needles. If they said to put them in your ankle and you put them in the hand, that's a sham acupuncture. The researchers induced an asthma attack, and then they measured the lung function. They measured the ability to take in and blow out air, and the perception of symptoms. Now, the albuterol, the drug, improved lung function measurements. The other three did not. But the patients reported feeling just as good as whether they got the placebo or the active treatment. So there's a lot going on in your head when you have asthma. Okay, finished. Questions? Comments?
How do you induce,
Don't believe a word you said.
how do you induce an asthma attack?
I don't know how they did that. I didn't look into that to see how they did that, but they did it somewhere.
Got another way for me to torture people.
Yeah, yeah. Probably would do that. You gotta get asthma to be able to torture. Yeah, Jack?
Well, with regular prescribed medications, a lot of effort is put into determining appropriate dosage levels and the frequency related to the decay horizon of the medication. And we don't get that with other medications like salt palmetto. It's very hard to find out what an appropriate dosage is. Most people just take a pill.
It's never been done.
And my question is, does that suggest that clinical pharmacology is beginning to converge with the primary care physician's practice in some way? Or is primary care physician's practice now principally the prescribing of medications, or is there a divergence between his practice and that of a clinical pharmacologist?
Well, the mechanics of medical practice in the general practitioner or family practitioner's office now is such that it's directed by forces outside of himself or herself. They are forced by virtue, first of all, most doctors now are contracted. Very few doctors are private, very few doctors practice by themselves. They're either with a group or with a company. I went through this with the medical complex in the country about who controls the practice of medicine, be it the government, the insurance company, the VA, the major hospital, the major university hospitals in the country. All these forces affect how the doctor practices. And the major effect on it is he doesn't have the time. He doesn't have time. He's got to see a patient every 10 minutes. Well, it's very hard to sit down and talk with somebody in 10 minutes and even find out what's wrong with them or what they're complaining about. And so the tendency, therefore, is take this medicine. What's your problem? We got this, and take this medicine. Come back and see me in 2 weeks or a month or 3 months and let's see how you're doing. But all therapeutics in medicine is trial and error. You give something, you try it, you see what it did, it helped, it didn't help, and this side effect, that side effect, no side effect. You raise the dose, you lower the dose, and until you find what's right for that particular person. I think the time that it takes to try to do some even simple psychotherapy for a patient who has symptoms which are probably due to nervous problems or nerve problems, is very, very difficult. And unless you set out a particular time of the day and say, I'm going to do this without else. So it's very rare. So then, yes, you go to the doctor, he tries to figure out what you got, and he gives you a prescription, you take the prescription. Then he juggles it to see. All the testing has been done as to what's the proper dose and what are the side effects. Of course, the proper dose for a 100-pound woman and a 250-pound man is not the same. So you have to, and that's really the art of medicine, is to tailor the therapy to the patient and the particular patient based upon whatever information you can gather in the short time you have to do it. That's the best answer I get. The practice of medicine has totally changed from when I practiced medicine. It's different. Not for the better, I don't think, but different. Okay, anything else? Okay. All right. Well, we got done in a reasonable time.